Welcome, everyone. My name is DJ Wells, and you've joined us once again for Coping with COVID, our weekly conversations with Dr. Mensah and lots of other folks, today just with Dr. Mensah, regarding
Sir,
what regarding those things that we're all wrestling with as it relates to the COVID-19 pandemic. Today, what we want to do is kind of open the door for conversation regarding all of the politics, all of the things that are going on regarding this pandemic. There have been lots of issues out there. We've touched on several of them over the course of the several months that we've been doing this, but let's have an in-depth conversation about some of the political landmines that have popped up as it relates to this pandemic. Some of the things that are on all of our minds. Several of you have already sent in some questions, and we'll certainly attend to some of those questions as well. And we encourage you to send in questions now during this broadcast. I see several folks are logging in, so I think you're all anxious to be a part of this discussion, and that's a good thing. We want you to be a part of this discussion. During the broadcast, if you have questions, there's a Q&A tab. If you're watching on your computer, it should be at the bottom of your screen. If you're watching on a phone or a tablet, it might be at the top of your screen, but click on Q&A. And if you've got any questions, type them in, and we will make sure that we include that as part of our conversation. And so, Dr. Mensah, as always, welcome and thank you for your time. And any opening shots that you want to put out there, any comments that you want to lead off with as it relates to this kind of very broad and free-form topic?
well, as usual, Mr. Wells, yes. First of all, I want to thank you. Many of you don't know Mr. Wells. He's quite the statesman, quite the educator. He's an adjunct professor. He's been in academia for a very long time. We've known each other since our collegiate years when I was a political science sociology double major while being pre-med, and he was Mr. Communications and radio and television. He should really be the personality moderating the shows here. But that is to illustrate how we have sort of a multidimensional approach to many topics, including this. So we're viewing this particular conversation from both the sociological, the political, as well as the medical perspective. In addition, Mr. Wells is highly versed in communication, so the idea of sharing ideas and the ramifications of how things are formulated and placed in the minds of individuals is really what we're here to talk about. Mr. Wells knows me well enough at this point in time to know my particular frustrations around the idea of minimalization of health and life, secondary to something as mundane as politics. That cannot be tolerated. And that's the very frank conversation we're going to have today. I want to make it very clear, I don't have any particular political affiliation. When it came to voting or when it came to supporting any given candidate in any arena, whether it's the governorship or the presidential arena, I've always been an individual who simply looked for the best candidate. I didn't ask myself who's Republican or who's Democrat. So for me, there is no particular tie in any of those regions. As a physician, however, I am under oath to do the best that I can do for any patient that we have. Whatever information we have known, it must be shared. That is part of what physicians do. And at this point in time, that's what we're about to unleash. So if you have a particular political affiliation, I'm so sorry. I'm not sorry for what I'm going to say. I'm going to be sorry for what it is you may feel if you are enraged by what it is I say. But I'm here to help save lives like all of the rest of our doctor colleagues are here to do. In times of crisis, there is no politics. In times of crisis, there is no ideological affiliation. It is about saving our people and saving our planet, our society, our culture. One life lost is one too many. So Mr. Wells told me the other day, yes, indeed, I'm rather verbose, and that's all right for this particular moment, because that's my introduction. We haven't even asked a simple question yet. So there you go, Mr.
Well,
Wells.
well, again, Dr. Mensah, as you just pointed out, I do comment on your verbosity on more than one occasion.
Indeed.
And you have not disappointed in our introduction here, but let's jump into the meat of things here. And let's start with a simple medical question, since you talked about, you know, the importance of saving lives. One of our viewers wrote in and asked about flu vaccines, which is kind of an interesting conversation to have right now, given the COVID discussion. You know, how do we feel about getting a flu shot this year? You know, is there danger in exposing ourselves to other viruses, even in vaccine form, with COVID out there lurking?
You know, it's lovely for you to start off with such a simple question. This is the one subject matter that I seriously had to ponder for a very long time. And I talked to quite a few colleagues around the world about this exact phenomenon, because I did not want to be purely biased on this. And I think it's very well agreed. There is a huge consideration for the individual. We talk about bioindividuality when it comes to treating patients. And at this particular point in time, it's not a simple answer in terms of who should get a flu vaccine and who should not. The real key is it depends on who you are. Now, it's because that kind of question exists that we're actually going to do what is going to probably turn out to be a two-part webinar with regard to presentation, to kind of share with you what goes into the thinking process of any physician in terms of answering that one question. And it is mind-staggering how in-depth you can go. And we're going to go in-depthly. So we've got at least one webinar that's going to be devoted to simply answering that question, because it's not simple. But as an introduction to that, one answer that we would give is that it really depends on who you are in terms of your comorbidities. So if you're someone who's got diabetes, hypertension, asthma, any other kind of respiratory condition, these are areas where certainly you should probably consider having the flu vaccine. If you're an individual with an autoimmune disorder, that might actually be questionable. Okay. If you're somebody who's sitting there as an average 20, 30-something-year-old who seems to be in very good health condition, well, then the risk potential for having the flu vaccine to be protective for you, well, that's really kind of up in the air and questionable, maybe a matter of personal preference. If there are challenges that underlie this condition or the person's human condition, then that's really what you should consider with regard to getting the flu vaccine. Talk to your doctor, first of all. That's number one. Mm-hmm. Talk to your doctor about how they view your particular need, because they know you best. But outside of that, some generalities come into play. And it's interesting, talking with my lovely and brilliant colleague, Dr. Judith Bowman, she brought up the fact that when we're looking at autism, for example, the real interesting irony, despite the number of challenges that an autistic individual has, everything from undermethylation to usually copper excess to even pyrrole disorder and zinc deficiency, they're still hardier from an immunological perspective, for the most part, than most adults are. And you know, when Dr. Bowman said that to me, I had to kind of go, what an interesting conversation. Because if you take those individual parts and you remove them and look at them on their own, kind of like the Matrix in 3D animation, here's undermethylation, here is copper toxicity, here is da-da-da. Each one of those, in theory, should predispose you to being at greater risk for getting illness. But you combine all these things, put them in a child who's got autism, and they will probably outperform any given adult as far as immune function is concerned and survivability. So it's not a simple question. Now, I know those of you who are out there who are our patients and who know us, you're probably going to be calling about that, because I've had conversations already over the course of several weeks with family members of patients who want to know, should we give little Johnny the flu vaccine? And then that answer turns into, well, then what about Edgar? And what about Janice? You said this, but you're not seeing that about the other two.
Right.
Every child, every person is different. Okay. So these are things you want to consider. Really just talk to your primary physician. That's number one. But especially if you've got an underlying condition, certainly like everyone has been talking about, you should probably get the flu vaccine. Okay. What we don't want to do, and this is where Mr. Wells, you're prefacing all this, is to have the flu on top of COVID.
Right.
Folks, this is an animal we have not encountered before. We don't know how it's going to respond in the winter months per se. We have great ideas, but we're not 100% sure. And then we don't know what it's going to do if there's another viral entity superimposed on it. So all these things are going to be determined, but that's the very short answer, so to speak. And we will have an entire, if you thought that was long, wait until we get into our presentation with this. So that's kind of how we would look at it. Okay.
And another interesting perspective to this whole conversation, this year especially, every time somebody so much as gets the sniffles, they're going to say to themselves, do I have COVID? You know, because so many of the symptoms of COVID mirror so many other things, from the common cold to more serious forms of the flu. Anytime we get sick, there's going to be that fear, there's going to be that concern that COVID is in there, COVID is lurking, and so, you know, we're going to be wrestling with that as well. Just the overall anxiety of anytime someone's sick, are you COVID positive? And I think that's going to create a lot of dysfunction in the medical community as well.
Agreed. And one of the things that we really have to look at, it's time to really stop playing games. It really is. We need to get the appropriate tests that take 15 minutes to give us an answer available in every hospital, every clinic, every institution. Because when that flu thing hits, we need to be able to determine if this is COVID or it's not. Okay. And so if we're not really ready and in place, then we're going to have one heck of a season coming up. And it's going to be detrimental. It's going to be lethal if we're not careful.
Mm-hmm. Absolutely. Since we're talking about vaccines, someone else has written in that they're concerned about, once the COVID vaccine actually comes out, whether or not they should rush out to get it, given the fact that this vaccine has been fast-tracked, given the fact that typically a vaccine coming to market might take 2-3 years, and we're talking about 6 or 7 months before we may have something out there on the marketplace. What are your thoughts on how safe and how efficacious, how effective will this vaccine be?
You have picked the easy questions to start with. I thought the flu one was bad, the vaccine. Look, we don't really know until we have the final product to really be able to even anticipate how to answer that question. Okay, I don't know of any physician who, in a private space, would say that I'm comfortable with a vaccine that all of a sudden shows up 2 days before it's time to vote in an election. Okay, when we're really anticipating a real vaccine to take, as you said, another 6, 7, 8 months. Okay, so quite personally, I'm highly skeptical. Highly skeptical. Mm-hmm. And this is about safety. So it's not about politics. It's not about anything else. I'm highly skeptical of anything that shows up with a claim in the first month. But then again, I'm highly skeptical anyway. And anybody who knows me knows that. Okay. So we don't rush out to do anything. We really look carefully to analyze. What is the data? How long has this been tested? In whom has this been tested? Laboratory, human studies, et cetera, et cetera, et cetera. And what were the real effects? We saw one issue with a company that will not be named, where the trials were stopped for a moment because of an adverse effect.
Right.
So put it this way, if I'm talking to a patient right now, one-on-one in private, okay, the odds of me recommending a vaccine that just comes out would probably be fairly low.
Okay.
Probably.
That's a fair answer. Very good, very good. We've got someone who is burning up our Q&A board right now, asking specifically about, and actually I have some personal experience with this, and so I'm real curious to get your take on this, Dr. Mensah. The fact that overall as a nation, we are kind of unhealthy. This is not a particularly healthy nation. The world to a lesser extent, but certainly that's the case in the world as well. And we've seen that folks that are infected with COVID and who are young or who are healthy and have strong immune systems tend to get through this pretty easily. I personally have 2 young people in my family that have tested positive and have gone through COVID infection pretty easily. Should we be talking about the overall health of the nation in addition to, or even instead of, our conversations about avoiding COVID infection in particular?
First of all, I have to scold you because I disagree with what you just said.
Okay.
Kids do not go through this easily, collegiate or otherwise.
Mm-hmm.
There's a difference between survival and then sequela. All right. You survive COVID, a tremendous number of people then have neurological problems.
Mm-hmm.
That may take months, years. We don't even know for some of them. A tremendous number have vascular issues where limbs may be removed and so forth. A tremendous number of individuals have a whole lot of other challenges, including mental health issues after COVID is done. See, the problem is that COVID affects the vascular system. Now, some institution just came out with that, and I think it was one of the vascular societies in America, and we talked about that several months ago.
Mm-hmm.
Okay, and we have seen exactly this piece. So anywhere you've got blood vessels, which is the entire human body, any system can be challenged. So while Mr. Wells is correct about the fact that the majority of younger people tend to do okay, we've seen everything from death to neurological issues to in those age categories. So we don't take any individual acquiring COVID lightly, not at all. You are blessed, Mr. Wells,
Yes.
to have had adverse effects thus far. But we don't know what's going to happen in the future with regard to some of the other manifestations. If nothing happens, then wonderful, beautiful. We're all happy. We're not trying to impose this on anyone. We're hopeful nothing happens, but we've seen one too many stories about young people with very tragic outcomes. And I agree. We do need to focus, though, on the health of the country. Okay, and it's very hard to do that when we are a nation that pretty much eats like crap. Let's just call it the way it is. We eat horribly. We treat ourselves horribly. One of the most interesting indicators, I was taking my youngest a few years ago to Walt Disney World in Florida. And they shut down this ride that gave me just, I can never get this "It's a Small World After All" song out of my head. Because when I took my first baby to Disney, that was 4 or 5 years of "It's a Small World." I could never get to another ride. It's always that one. And then when the next one came along, I thought I was out of the woods with "It's a Small World," and I'm right back to it. But that ride was closed down the last time I went because they had to reconstruct the entire ride to accommodate heavier, bigger people.
Wow.
When those rides were first created, that was back in the 1950s, as I understand it. And it was designed for people of a certain height, a certain weight, a certain build. Those numbers have morphed since that time. And Mr. Wells, they literally had to close down the ride and build everything from a new physics perspective. We didn't get that way because we're being healthy. Okay. So in America, we know we're eating all the wrong stuff, not getting enough exercise, the whole list. Everybody's heard it 1,000 times. When you start to see actual infrastructure changing to accommodate what we've become, that's a problem. So in many respects, the vast majority of us are truly compromised when it comes to real survivability. Okay. And that's what this particular virus seems to enjoy. Compromised individuals. So you may look good, you may look great, you may seemingly have no problems, but that virus seems to be able to find your Achilles heel, and then it attacks it. So Mr. Wells, you're right. We do need to look at the health of the nation. And that's something that every practitioner should be talking about with their patients. They already have, let's be real. For the most part, they have. But it's an ongoing conversation because most of us don't turn around and correct the problems that we're seeing, instantly. We'll think about it, philosophize about it, make an attempt to do it, fail, stop. The whole cycle continues several times. But you're right. The health of the nation is really key here.
Yeah, I absolutely represent that remark.
You're not alone, sir. You're not alone. Okay.
And another point that's being made by one of our viewers, and that is that when we talk about young people tending to get through COVID a little bit better than others, that does not preclude them from being unhealthy as well. They are also engaging in the same poor dietary and exercise habits that the rest of this country is engaged in. So they also have, in many cases, those same comorbidities that we're talking about.
Yes, they do. And we talk about comorbidities. Thank you for bringing it up. We talk about comorbidities in basically older individuals, but when we're talking about children and teenagers, don't forget they too have asthma. Some of them have bronchitis. Some of them have other respiratory or even cardiovascular issues. And this is so sad. When we were growing up in medical school, there was no term called called obesity in children. There were sort of these breakdowns of being larger in weight, but never the term obesity was to be applied in a child. That's a whole different story now. So what percentage of our children are overweight? What percentage of our children are obese? Well, guess what? Now they are in a high-risk category. Okay. And if you look at the children who have died, quite a few of them fall into that particular space.
Well, since we're talking about children, let's talk about education, because certainly several schools from kindergarten all the way through college have moved to remote learning because of COVID infections, because of the fear of COVID infections. Is this the right move? I mean, certainly there are arguments to be had on the other side regarding socialization, regarding the effectiveness of teachers and being in front of a trained educator as opposed to working in front of a computer screen. So there's all kinds of arguments on both sides of this. Where do you stand?
Well, we did call this straight talk, didn't we?
Yes, we did.
So let's just be real. My perspective, again, is always about life. If you don't have life, you don't have to worry about who's teaching, because there'll be no one to teach.
Mm-hmm.
If you don't have life, you don't have to worry about teaching anyone. There'll be no one to teach. Okay? This is a critical time with a creature that we do not know too terribly well. We have only some level of understanding, and things continue to evolve. We know that children, while they can be very resilient, they're like little secret agents. They're like Trojan horses. They will contact this virus. They'll transmit it to somebody who is vulnerable. That is a parent, a grandparent, an aunt, and the teachers themselves. Right. Most of them, as wonderful as they are, would be higher risk. And that's why many teachers have retired. Many teachers have taken sabbatical. But there are teachers who said, listen, I just want to teach. And I can't fault them. As an adjunct professor, I understand. I love being in front of a group. I love being there when I can be in contact with residents and with educators and We've been there, done that. But this is not a time for worrying about the modality. It would be different if we had no options. Okay. But we do have options. This may not be the most effective way to communicate and to learn, but it is the safest way to do that. And we have to look at the safety. Our kids may be okay, but cold and flu season comes, and how many people in the family get colds and flus? And their number one excuse, well, Johnny brought it from school.
Right.
Now, if Johnny brings home COVID and mom or dad gets exposed, let me ask you, what kind of trauma happens to Johnny one day when he realizes that because he got sick, mommy or daddy died? And what are the ramifications of not having a father or a mother in the home for a child for the rest of their lives?
Right.
Okay. Families have to be very careful and cautious. There are many, especially in Illinois, there are plenty of suburban families that are absolutely unhappy with the idea that there is sheltering in place and education has got to be online and at home. But I don't think that if they're exposed and the worst outcome happens, that they're going to be thinking the same way once they're attending a funeral, remotely, no less.
Right.
Okay? So I think you know where I'm coming from here.
Oh, absolutely, absolutely. And
the safest piece is always what we consider. You can always go back when this is over to in-person school. But please, we can shelter for a minute here. If a minute means a year, 2 years, as long as we get this thing beat, so be it. At least everyone is safe and there are no people being put at risk. Administrators, educators, archdioceses, okay, they all have their reasons. And I understand that. But let's just put it this way. I'm walking the walk. I'm not just talking. My child is not in school right now. She's doing remote learning, okay, for a variety of reasons. The risk is not worth it, okay? So I'll put it to you that.
And I can say myself as an educator, you mentioned before that I'm an adjunct faculty at a university out in the South, in the Chicago Southland.
But you were also an administrator for the University of Illinois at Chicago.
Yes, absolutely, absolutely. But well, thank you for pumping me up, Dr. Mensah. But I'm talking about, but I'm talking about my teaching right now, and that is the university where I'm teaching has gone to all remote learning, and so except in the case of some very specialized classes that need lab work and the like, and so I've had to adjust my own teaching to an online presentation. And so I was just sharing with my wife the other day, laughing at the fact that I was sitting in front of my computer, pre-recording a lecture for my students to then watch later on in the week. And my presentation style in front of the computer, I had to really think about it and revisit all of the things that I typically teach standing in front of a classroom. And so it's making educators kind of rethink how we do things as well. And sometimes that's not necessarily a bad thing. It's making us rethink and reconsider our curriculum in ways that perhaps we hadn't had to do for some time. I have to admit that, I've taught a couple of the courses that I'm teaching right now for so long that I could walk in on autopilot and teach the course without really thinking about it. But now that I'm presenting it in an online fashion, I have to really think about how do I make this material truly understandable for my students in a way that I can't do because I'm not sitting right in front of people and seeing their eyes and recognizing whether or not they're getting the concepts that I'm talking about. And so it really has changed the face of education, I think, for the better, and I think permanently. I think that all education is going to be, at the very least, in some kind of hybrid format from this day forward, so that if we ever do have another pandemic, we can very easily transition back And also because we have these technology tools, now we're using those tools even better and more effectively so that we're sharing all the more information with our students.
I was going to ask you that, actually. I was going to ask you if you thought it was forcing you to become a better instructor
Mm-hmm.
as a result of this. Okay.
Mm-hmm.
And you said exactly what it is that we've been thinking for a long time, talking to other educators and other administrators. Look, this is the future.
Mm-hmm.
We're balking at it now. But the fact is, I don't find it ironic that all this technology that allows us to communicate visually happened before the COVID. I think there's always a schema in place and a timing. Okay. What we even envision is that your education may be global at some point in time or another.
Yes,
You can
absolutely.
be sitting here in Chicago and attending the University of Gdansk or whatever institution in France simply by remote, because you've earned that capacity and now you have the ability.
Mm-hmm.
You don't necessarily have to be there physically. So the whole virtual world of education, folks, we better get used to this. If you're hemming and hawing because of the transition, transitions are painful. Very few transitions are just easy and awesome. They're painful. But what happens is that you're giving birth to something amazing and new.
Yes.
Okay. And you still have to hire trained professionals to represent your institution to deliver that message.
Right.
So it's not as though the idea of working for a given university or a given facility is going away. It's not. And by the same token, you still have to pay for it,
Yes.
right?
Absolutely.
So these trained individuals, they all have to be compensated. So the idea of money and funds is something that's also totally different. Now, of course, we get into the whole idea of sports in universities and how much money they bring in and endowments. That's a whole other picture.
Well,
But
that's one of the questions that's kind of lurking here as well, that somebody else has sent in. And well, let's just go ahead and jump right into that conversation then, because so many folks have thought about, what we just saw just recently, the Big Ten Conference and the Pac-12 Conference, the two major football conferences, who had initially said that they were going to cancel football and all other intercollegiate athletics for the semester, for the fall at least, have kind of caved to pressure. And so now it looks like the Big Ten and the Pac-12 are about to start up their football seasons, albeit a little bit late. Now they are citing the fact that they're going to have all kinds of COVID testing in place, all players and all faculty and all coaches and all field personnel are going to be tested every day. Of course, these universities, you mentioned before the need for having the right tests in place. And these universities probably have access to at least the most advanced and available tests that are out there. How do
yeah,
you
you think
feel?
that.
You would think so. My question
Yeah.
to you is, how do you feel about this? Is the Big Ten caving in, or does it make sense that they have enough mitigation strategies in place that they can do this safely?
I'm going to answer that question in reverse.
Okay.
First of all, there's no such thing as what you just described.
Okay.
There are not enough mitigation circumstances. We are right now worst on this planet in handling this situation, this COVID. Okay, last as far as I'm concerned. Well, we tie with certain other countries that are doing the same thing we are, but we're not even close. So, given the disorganization, given the ragtag approach to handling this, it's highly unlikely that any institution has got everything in place. First of all, this thing is communicable by respiratory droplets. It is air transmission, and it has to do with a lot of people being, or even one or two people just coming close together. Now let's talk about college, for Pete's sake. What is college? It's a potpourri of social interaction, whether in the daylight or in the darkness. Okay? Those individuals are now going to be going onto the field, whatever that field is, the court, the field, whatever, and interacting closely with other individuals. There's no way on this planet you're not going to see cases of COVID showing up. It's going to happen. Now the question is, what are you going to do about it when it does happen? And I hate to say it, we know collegiate athletes, basketball players who had idiopathic cardiomyopathies. They had problems with their hearts and they didn't know it, and they just fell, dropped dead on the court. That wasn't a contagious situation, but it shows that there's some athletes who are actually vulnerable to illness. And so there's going to be some athlete on the field who will contract this thing and not do well. Statistically, it's going to happen, okay? I understand the pressures that parents have because they want their kids to move on to the next level. And if they're not playing, maybe this is their last year, their futures are whatever have you, that's a bit of a challenge, okay? But we're not dealing with those issues. The issues we're looking at is, let's keep our kids not just alive, but let's keep them from sharing this and transmitting this to other people, to older individuals, family, whomever. Okay? I'm not in a place to say what caving as a term is to the administration of any institution. Cannot go there. I don't know. That's for them to decide. As a physician, I just ask the question, is this the best way to go? Okay. We can't play sports in a virtual world. Not yet, actually. I imagine somebody's been working on it.
Well,
right?
I was going to say, you haven't seen my daughter play Wii Fit tennis or something like that.
But we really have to. This is a testing ground. It is a testing ground. It is a time to learn. And unfortunately, I think the wrong message is being sent by the activation of collegiate sports right now. If I had a child in collegiate sports, I would say no. I would not do it. But that's me. And by the way, all this is my humble perspective. It's not supported by institution or anything else. It's Albert and DJ, Dr. Mensah, Mr. Wells, talking. That's what this is about.
Well, then, based on that response, I think it's safe to assume what your response might be regarding high school sports and youth sports. I'm sorry.
Even.
Yeah, I agree. Like I said, I knew that's where you were, but certainly that has also become, since we're talking about the politics of COVID, that has certainly become a political issue as well, and particularly here in Illinois. Those of you who are watching around the country, Illinois is surrounded by states that are participating in high school athletics, and so there's lots of pressure on the governor right now to allow for more sports to be activated on the high school level, because we're literally seeing parents of high performing athletes moving to other states just so their kids can play. And Dr. Mensah, you're saying, you're kind of prioritizing the wrong thing here, I would think. And to Governor Pritzker's benefit, he's held strong on this.
Well, let me tell you, I did say I'm not political, but I have to give credit where credit is due. The leadership in Illinois has been tremendous during this process. They've been doing the right things for the right reasons in the face of challenge from the federal government. And I'll just name him Pritzker. While we've had our differences of opinion about some things, and of course he has no idea because he doesn't know who I am. But what he's done for the state has always been in the best interest of the people relative to this crisis. And he and the mayor of Chicago, Lori Lightfoot, I think have been tremendous during this process with the limitations of help from outside sources. But we still have to remain strong. I mean, going out to play sports, listen, if everyone who had this virus all of a sudden exploded, you'd think twice about saying, let's go out and have these sports, okay? But let's talk about what happens when a collegiate gets sick, all right? And let's say a high school student gets sick. And maybe it's not 3 or 4 days of stomach ache or throat ache or whatever have you, pain, inflammation. Maybe it turns into 2 or 3 weeks. So now we miss 2 or 3 weeks of school. Maybe we actually fall far enough behind that we've got to repeat an entire quarter or semester. What does that do now? That pushes back our agenda, our schedule. There's going to be hospital bills associated with that. There's then going to be recuperation associated, assuming this person recuperates. What if now there's a respiratory issue that becomes pervasive? So now next year's sports potential is gone, okay? Whether it's high school or college, you don't have that opportunity just because you caught this virus and you were one of those folks who are challenged, and now you don't have the capacity anymore to play. Highly demoralizing, financially costly, and future prohibitive. Those are the risks we're talking about. Short-term gain versus long-term consequence.
Right.
That's a decision that every parent and child have got to make, but don't make it short-sighted. It's not fun on the other side at all.
Absolutely. Absolutely. Well, you've complained about how tough some of these questions have been. So I'm going to toss you a softball here, to use another sports analogy. Something that we've discussed before, and that is treatment and prevention. And I know that you've been very outspoken about vitamin C and zinc and a couple of other supplements in terms of ways to both prevent COVID by building up your immune system, and then once you do have it, if you do contract it, ways to kind of treat and combat it. So I want to provide you an opportunity to share that with our viewers once again, just so that we're all on the same page about things that we can be doing to try and overcome this.
Yeah, and we've talked about this so much that I'm not going to belabor the point here, but you know, the real issues revolve around how the COVID itself really structures and destroys. And what it does is it breaks down parts of your system that are essential in allowing oxygen to be carried to different parts of the body and to be released. It basically stops your system from being able to carry oxygen. And believe it or not, part of that mechanism, the way it does that, the way the body helps oxygen carry, helps hemoglobin carry oxygen, is with the structure known as ascorbic acid. Ascorbic acid is literally the binder that connects these pieces. You unloose that binder, that's like trying to walk without your shoelaces tied. You're going to fall. Okay. In this sense, that joining can't happen. You've got loose oxygen here, you've got iron over here, and there's no cohesiveness. So we recommend vitamin C in very high dosages, okay, in the short term. And those dosages are actually in our other videos, or go to one of our sites for that sort of thing. Zinc is really important in immune function, to say the least. And we already know everything from cold ease to airborne. These are elements that people use for colds and flus and so forth. Zinc is the real major piece there. Okay, so what people are not talking about, which is so frustrating, is that the major capacities for improvement revolve around natural mechanisms. Okay, the way I like to talk about it is, you know, here we're busy looking for vaccines, and we're busy looking for drugs, and we're looking for everything except what is natural. And natural's got a weird feeling towards it for many people. We're so used to the technological and the improvements. Well, look, for those of you out there who have a car, okay, because I love cars, so let's just talk about them. If you've got a Mercedes-Benz and the engine breaks down, nobody says, hey, let's put some duct tape around the engine and maybe that'll hold it in place and go ahead and drive your car. If you're the one who bought that Benz, you're going to say, no, you replace those parts and I want the best parts you can find. But the parts are the same as the original parts of the car, okay? If you got a Ferrari, and many of you may not even know what a Ferrari is, but ultra high-end supercar, okay? There's no way on earth you can do anything but get the same robust, high tensile, high intensity parts to fit that engine, okay? So when something breaks down, you want to have the same pieces there to fix it. But what is breaking down with COVID are these elements of vitamin C, that is ascorbic acid, iron challenges, etc. In other words, the very regimens we talk about from treating, people call them natural because they really are. These are actually the parts that are being disassembled, that are going to be disheveled, broken up and destroyed by the COVID. Well, you've got to replace them. And that's what these things we're talking about are. It's the vitamin C that replaces, the melatonin that stops inflammation, the zinc that provides healing. These are the pieces that provide actual healing. So prevention involves really taking the appropriate dosages of these nutrients. It doesn't mean you won't get COVID. What it means is that, as we've seen with some of our patients, instead of being out for 2-3 weeks or several months, you may get fatigued, feeling a little bit run down, a little sick for about 3 or 4 days. And then guess what? You're back to normal. Fighting the good fight is what we're talking about, okay? And then if you get it, there's a more severe regimen involving those particular elements that you need to be on. So while we're always talking about vaccines, because let's face it, that's the moneymaker. When we're talking about drugs and pharmaceuticals, those are the moneymakers. But when we're talking about actual practicality, for maybe $30-$40 total, okay, in terms of supplements, that's what actually fixes the problem. That's what we need to be talking about. Enough of this dancing around the tree here. This is about reality. Use the parts that you need to fix the problem. The problem is many institutions don't know what the problem is.
Right.
But we've been working globally with researchers and doctors from all over the planet, and we saw these things much earlier. We're on record already from 3-4 months ago. And now they're beginning to see that what we were all talking about is true, okay? So this is the regimen. These are the kinds of things we need to do.
Okay, well, all right, so that's it for the softball questions.
Okay. Give me the tough.
Masks.
Yes.
I think that's a tough one because,
I don't.
well, it's tough in that it is politically charged. I agree with you. It's not a tough question. We should be wearing them. And yet the issue of wearing masks has become so politicized. It's, this idea of infringing on our civil liberties and such that has been wrapped around this notion of wearing masks. And then also, some folks have thrown in some additional, what they try to say is scientific conversation about it, like, you're breathing in too much of your own carbon dioxide and those types of things. So what are your, I know what your thoughts are. I know we should be wearing masks. Let's hear why.
Okay, well, first of all, let's go to this carbon dioxide thing. I'm in 1000% agreement, okay? I have talked about this too, family, friends, and publicly. You are breathing in your own carbon dioxide much more than you should. That's why the question becomes, should you be putting kids in school in the first place, where they can be much more safe at home? Now, I've actually shown administrators this new sort of hazmat suit, if you want to call it that. It looks more like a Lost in Space spacesuit from here to here, that creates your own environment. And so there's none of that stuff with a little respiratory thing on the back. It looks like Space 2099. But if you're not going to do that and you want to be in public, you've got to protect yourself, okay? Forget politics. This is just about your own health. But see, here's the thing. You can't utilize your civil liberties if it hurts somebody else, okay? That's where your freedoms stop. And people don't understand that. You are free to do whatever you want to do, but people are also free not to get sick. We've seen most recently that from one wedding where there were 17 people, 176 in several states further away, 176 people have contracted COVID, traced back to just one wedding where 17 people attended, okay? I don't think those 176 people are exercising their freedoms to not be sick, because certain individuals had to exercise their freedom to simply not choose to wear a mask, okay? they're trying to force these concepts of herd immunity. They're trying to, I don't want to use the term force, but suggest mass vaccinations. And I'm not necessarily against vaccinations, but what are they doing? They're saying we want to prevent people from getting sick, right? So you have to compromise in certain respects in order to maintain freedom and liberty for all. And that's what it really comes down to. This is not about somebody's civil liberty. Your liberty is to be free and healthy, not to be free and sick. Their liberty is to be free and told the appropriate truths, not to be lied to, okay, for the sake of political gain. All right, we're trying to make sure you're not sheep walking off of a cliff, okay, because the lead sheep says, come this way. All right, you can see the cliff. You may not want to believe it, but I hate to tell you this, a little story about a fellow named George Reeve. Growing up, I was a big fan of Superman. And George Reeve played Superman back in the days when it was black and white. And he believed he could fly. He did. Jumped out of a window. Died because gravity was real. It doesn't matter what you think. The question is, what is true? What is real? Because that is what's going to be interacting in your system. We've had way too many stories in the news about individuals who didn't believe that wearing a face mask was beneficial. Some of them were deathbed confessions where they said, I wished I had taken this seriously and worn a mask. And then they died. Or relatives sharing that information for the person who did the same thing. So that's not about, and there's, what people don't also understand is that it's about volume as well. How many of these viral particles are being exposed to the individual? Concentration matters. When you wear a mask, you decrease that concentration of transmission. It may not be 100%, but you decrease a huge number of viral particles from being spread. So that way, other people are minimized from exposure. Okay, this is live.
So speaking thereof, and I just got an interesting question in, can we engage in some kind of outside social activity, like attending a wedding, if everyone's wearing masks? I mean, how safe are the masks, or do we need to still maintain that social distance? Do we still need to do things virtually?
We do. We know that the masks are helpful, but if they were a 100% preventative measure, well, there wouldn't be an issue about opening up schools or playing sports. You could wear a visor playing sports and you'd be covered. That's not it. It decreases the capacity for infection and spread, but it's not a 100% mitigating structure that's in place. It's not 100%. So you do still have to distance. You still do have to do the appropriate things, but recognize that wearing a mask is part of it. It's part of it.
So then let's talk about businesses, and we've heard all of these conversations regarding essential workers and essential businesses. We've heard conversations regarding the economic impact outweighing the health and social impact of social distancing and all of that. And then you've already made a comment about how some states have been more aggressive in terms of limiting businesses opening or reopening, and you seem to be in favor of that kind of leadership. What are these issues? How do we reconcile the cost between keeping an economy going and robust and keeping people employed and so on and so forth versus the idea of being very strict in our social distancing regimen?
How about we take this one step further? You talked about the economy. What is the economy? What is it? It's an artificial construct. It's not real. It's not a living creature. Although many people would say, oh, yes, it's very, living in it. It's made me a lot of money. Okay. The idea is we have supply, we have demand, we have needs, we have resources, and people pay into an ongoing domino effect that provides security for some people and goods for another. Okay, let's talk about something different for a minute. How about we take a look at the number of Americans, citizens, permanent residents, and hire them. Let's hire them for a year. Let's hire them for 3 or 4 months at the federal level. Okay? Pay these individuals a regular salary. Now, we've done some interesting math. I'm not going to quote you some numbers because my math might be wrong. But if we took the total population of adults in the United States, which in our world is a kind of a guesstimation, and we hired them and paid them for 3 to 4 months, let's make it even more wicked. For an entire year, pay these individuals $70,000. Do you know we would come out with less money being spent at the federal level than we spent just in the first of our lovely gifts in terms of loans and all these other things to individuals here. Now, you pay individuals to shelter in place, but they can still pay their bills, they can pay their rent, they've got food, they've got da-da-da, 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 da. Okay? So if you're not an essential worker, you're still being taken care of. Now, what does that do? That allows the economy to keep going without putting anyone at risk. Now, I understand people who work in the food services, the mail, doctors, and dentists and individuals along those lines. But this to me is about taking a construct and saying, hey, what's important? People. What else is important? Economy. Well, how do we merge the two, keep everyone safe and keep the economy going? Money. Okay? We've got reserve money, so to speak, or money that can be generated and given to these individuals so that they can continue to feed the economy. And the businesses don't go out of business. Okay? Right. They keep going. They're being taken care of. And at least during this time period where there's so much difficulty, guess what happens? Social unrest is a different story because people are being taken care of.
Right.
Okay? A lot of stress is different. Unemployment, not an issue. Look at all the things that change because of one conceptual interventional shift in paradigm. Now, Dr. Mensah, I know people are going to say, oh, you're so full of it. That's not how it works, and blah, 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 blah. Folks, I got to tell you, it's being done in different countries around this planet. Okay? Different countries are doing it. And their populations, I'll never forget talking to one doctor. I said, how are things over there on the other side of the world? They said, we are all fine. And we are all content, and nobody is stressed. Okay? Bills are being taken care of. Children were being fed. School was continuing. Everyone is getting paid. Government directly depositing into accounts of personnel, of individuals. And guess what? COVID minimized, eradicated. Mm-hmm. Okay. Our stressors that want to push everyone back to work revolve around money. So for a minute, maybe we don't need to look at the idea of making a buck at every level from everyone by making these things loans. Maybe we actually do something strange, like actually take care of the population at hand. Mm-hmm. Actually find a different solution that allows everyone. And if, for those of you who are conservative out there, look at all the money you'd be saving. The cost savings alone, as I said, there would be no need for discussions around a second stimulus package. Right. Okay. The first one would be still covering all these folks. Okay. As long as bills are getting paid, rent is due, taken care of, everything else functional. Right. And the stress level of the United States of America would be so reduced. So reduced.
What one of our viewers has pointed out, and this is very accurate, that actually it's been done here in this country. FDR and the Great New Deal was all about hiring people at the federal level so that everyone could recover from the Depression. And so you're absolutely right. It's the concept of being more focused on taking care of people as opposed to taking care of businesses and the like I think is an important one here. And we do need to be focused on people's well-being as opposed to the economy's well-being.
But in all fairness, I do understand what folks are saying, but what I'm pointing out here is that both the businesses and people
Our
can be taken care of.
Absolutely.
And look, as a business owner, um, as someone who knows several different business owners, believe me, I understand the pains that people go through with regard to what happens to businesses. And my other point is that it doesn't have to be that way, even with this one paradigm shift. The businesses get taken care of. And so there's no question about their survivability and their employees' survivability and everyone else doing well at a time where sickness is rampant. Okay. But it involves thinking out of the box for just a minute. Okay.
And the important point here too is that when you do something radical like this, radical like taking care of people, you encourage people to stay home, which means we get through the pandemic that much quicker because there's less transmission of disease.
Absolutely. Who's going to go out and complain and fuss and march and picket and da 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 when you can sit at home in your little outdoor bathtub full of water, know you're getting funding, do your work as you can or need to, your kids are taken care of, your bills are taken care of, but you lose all the stressors around this whole concept of having to go out and work in a very toxic environment. Okay. I think we need a paradigm shift at this point.
Yeah.
Even if it's short term, a paradigm shift.
Absolutely. Absolutely. You mentioned working if you can. You know, we talked about education being changed forever as it relates to, hybrid classes and working from and taking classes from home, taking classes from a distance. We're seeing that in the workforce as well. We're seeing that many employers are keeping their employees at home, present company included. I've been working primarily from home, and yet we've still been able to do these webinars and be very effective in that. We've still been able to, with Mensah Medical, we've still been able to see patients and develop relationships, and so we've kind of shifted that paradigm as well. Again, I think for the better. The fact that we can focus our resources, including our own personal time as a resource, where we don't have to travel back and forth as much. We do have more time for our families and our loved ones and what's going on around the house. That shift has happened too. I'm assuming that you feel the same way, that this is for the better.
Well, I don't know. I miss you terribly, Mr. Wells. But we do what we can do and what we need to do for the short term. We still function. And I will admit, it's not always the most efficient way or the most effective way, but it is a way for the short term that we can get things done. And, what's very interesting is that a lot of companies are seeing that it can work. What I don't know if I should say this and ruin things for these companies, but many of them also realize our employees are actually working longer at home than they do in the office.
Mm-hmm.
We're getting more productivity from quite a few of our employees. Okay. And I just saw the cutest little picture. There's a dad sitting at his desk and he's got his toddler in his lap and he's saying, this kid basically doesn't stop, running around and doing whatever have you, but he's working. And I just thought, what tremendous bonding time and capacity for a parent. And while it's nerve-wracking at the same time because you don't have a babysitter, there's also something where you're getting to know your kids and you're getting to spend that quality time with them that you'd be missing otherwise. So there can be some pros in there, some really good pieces that a lot of which would be missed if this weren't in place. I think we're learning some things if we're smart coming from this pandemic.
Absolutely. Absolutely. Well, the last question that we have lined up here so far, and If anybody else wants to chime in at the last second, this is your last second chance. But the last question that I currently have is one that actually serves as a nice preview for next week, because next week we're going to kind of continue this conversation, but we're going to be joined by an old friend of the Coping with COVID series, Dr. Perry Pissarro from California, who has shared with us before some mental health tips. He's a psychologist that has shared with us a number of tips on meditation and maintaining mental health during this pandemic. And so he's going to come back next week and share with us some further conversations about what's going on in the world, but from the perspective of a mental health provider. But that said, the last question that we have kind of floating around for this week is, what is the mental health cost of social distancing? And I know that you and I have we've had some previous conversations, and we've had some previous webinars about the increase in suicide rates, the increase in anxiety and depression, the increase in domestic violence, those types of things that have kind of come out of this. What are your thoughts on just the overall mental health cost that we've had to wrestle with as it relates to social distancing and COVID-19 mitigation?
I like the term you used, cost. Okay. This is a very heavy and weighty phenomenon. It is a tremendous burden. Man was designed to be a social creature. Everything we do, from business lunches to celebrations, involves gatherings. We are designed to be social creatures. And when we are pulled apart, it goes against our innate design. And, while it may be hard to sit and be in the same roof 24 hours a day with your spouses and family and kids and so forth, it's horrifically devastating to be a single person, isolated from other people. Depression rates, as you've said, anxiety rates, that just that struggle alone can be very, very difficult for people. And emotionally, if you don't have a backup of some type, that's a very, very big deal. But, in other instances, many of our young people from age 18 to 34 have moved back home. And so when we look at this idea of isolation, what we're really seeing is people taking the opportunity to say, look, if I'm going to have to shelter in place, I'm going to go back and do it with my family. Okay. I'm not going to sit here, Now, not everybody can do that. Not everybody's got a family. I think it's a blessing that some of those folks can do that and do, but they also recognize that being alone can be very, very difficult. Some people are happy to be alone, and that's okay. But for many, there's a huge weight that gets lifted with that social interaction. It is a hard, hard piece to be in a disease state, a pandemic, an epidemic, which demic you want to talk about. It's hard to be in that space when you're alone. It is very, very hard for many people. And that can worsen depression. The future is in question. I was so used to going out and meeting people, and now we're just here. And virtual is great. There have been amazing things that have been done. Symphonies have been created in a virtual space. But it's not the same as being there in person. So I don't want people to think that I'm against being with people. Hardly. We come from a very gregarious culture. But we need to really understand that for the moment, this is something we've got to get through. So by whatever means we maintain social contact, please do. I don't know if you young people out there realize this, but cell phones were actually designed for talking, not just texting. And with the virtual world now, these cameras, you can actually look at people and speak to them. Okay, use that communication. We adults, on the other hand, our older folks, we didn't grow up with that stuff, and it took Me and my sister, for example, she's older than I am. It took us a minute to actually look at each other on the phone. Or the first time we did it, it's kind of like, this is too weird. Okay, let's go back to regular voice. But now everything is a video call, is a video conference, and it uplifts the spirit. It really makes you feel better to see that person. So if you can do it, wonderful. But do your best not to necessarily be totally isolated at this point in time. And if you start to feel worse, you start to feel really dark, really suicidal. We've had some great psychologists and therapists who have left plenty of numbers for help. Suicide hotlines, depression hotlines. Find someone, reach out. Don't just continue to fall into that dark abyss. Okay? Call someone. Call us.
Absolutely.
We'll try to help find you somebody. Okay?
Absolutely. Call us is very important, because we do have several resources available that we can guide you to, and which brings me to a reminder to all of our viewers that we will post the video replay of this conversation to our YouTube channel later on this evening. And if you go to YouTube and type in Mensah Medical and find our channel, you'll find all of our past webinars as well. And we've referenced some of those past webinars. And you'll also find in the comments section of several of those webinars some of the contact information that Dr. Mensah just mentioned, that several of our past guests have allowed us to go ahead and include their contact information. So you can reach out to these suicide hotlines. You can reach out to some of these professionals that we've talked with over the months, and find the resources and the help that you need. And again, I also want to encourage folks, go back and look at this conversation again. If there was something that we said and you want to go back and make sure you got it just right, or if something that we said resonated with you and you want to share it with your friends and colleagues, then we absolutely encourage you to, again, go to our YouTube channel. We'll also post links to this video to our Mensah Medical Facebook page. So there's plenty of ways that you can share this information with your friends and colleagues. Dr. Mensah, any final parting shots that you might want to share before we shut down for this week?
There almost always are. For people who are anxious, and I want to give this to folks, treatment for anxiety does not always revolve around a pharmaceutical medication with a potential for addiction. Okay? There's nothing wrong with those things in the short term, for the most part, depending on the medication for most people. But I want to share with you at least 3 to 4 what most people call nutrient or natural approaches to help with anxiety. And those things can kick in within 30 to 45 minutes. Okay? So number 1 I'm going to talk about is called inositol. 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 It is a very simple B-like vitamin. Remember, we're orthomolecular physicians, so we look at the molecular pieces here. Inositol, anywhere between 1 to 3 capsules twice a day, depending on your age and your weight. We're talking about adults here. Okay. Another one is called GABA Max. For adults, usually half of a teaspoon powder twice a day. Another one is called GABA, gamma aminobutyric acid, GABA. Usually 1 to 2 capsules in over-the-counter dosing twice a day. Another one is L-theanine, L-T-H-E-A-N-I-N-E, probably about 100 milligrams for the average person. There are many ways to approach conditions like anxiety, poor focus, et cetera, et cetera. But during this time, I don't know who isn't anxious. And that's why we're speaking specifically about substances that can help with anxiety. We're not talking about totally eradicating the anxiety, but we're talking about helping to bring it down so that the world is not quite so horrific for you. Okay. Ideally, talk to one of your trained physicians about this. Okay. Find a good orthomolecular specialist. They can guide you in that direction. But they're out there. They're over the counter. You can get them at a health food store, Amazon. Okay. I'm not selling you anything. what I want to do is to sell you the idea that there are things you can do right now to help alleviate that stress and anxiety a good bit, okay? And kids can use these things, but not at the dosages I gave you. So talk to somebody, all right? And that's my parting shot, Mr. Wells.
Very good. And I would be remiss if I didn't mention that while Dr. Mensah isn't trying to sell you anything, I am. And so all of those products that Dr. Mensah mentioned are available through the Mensah Medical website. If you just click on the store tab, then you can find all of those products. Of course, you can find them on Amazon and any health food store as well. And so we don't want to try and pressure you to go to our website, but we do have those resources available to you. And with that, we want to thank you for spending some time with us again this Thursday afternoon. As I said, next week we'll be with you again, and we'll be joined by Dr. Perry Pissarro to talk about some of these same issues and also some mental health and stress relief issues. Dr. Mensah, you had another point?
One more thing. We are going to be talking about, in a wonderful presentation format, some of the what's and whys around if and when and who you are as a person who should take the flu vaccine this coming fall, this coming season. Okay.
Mm-hmm.
We're going to kind of break it down from a medical perspective, not even orthomolecular. We're going to combine some of that, but a medical and orthomolecular perspective, some of the challenges around your physiology, how your physiology works, how your immune system works, what are the factors that you want to take a look at, and combine them with things like methylation and other biochemical imbalances to give you a very different picture around the who's, the what's, and the whys. So be watching out for that. That's going to be really, really important.
Absolutely. So we'll talk to Dr. Pissarro next week. Perhaps in 2 weeks, we'll go ahead and try and do that flu vaccine piece. So it is coming very soon, so be on the lookout for it. As always, thank you for spending some time with us. And Dr. Mensah, thank you for your insight. And we will see you all again next week.
Thank you very much, Mr. Wells. It's an honor as usual.
Absolutely. Thank you.